A major review of vaccines by University of Oxford-led team suggests the AstraZeneca jab raises the risk of blood clots and another serious condition that can cause bleeding. But the study found the risk of such problems following a coronavirus infection was still much higher. The University of Oxford-led team also found an increased risk of stroke after the Pfizer jab, but again at a much lower rate than after infection. The team said it once again showed the substantial benefit of vaccination. The research team looked at records from more than 29 million people who received a first dose of a COVID-19 vaccine between December and April, as well as nearly 1.8 million who were infected with the virus. The study published in a British medical journal looked for complications up to 28 days after being jabbed or infected. It found that for every 10 million people vaccinated with the AstraZeneca vaccine, an extra 107 would be hospitalized or die from thrombocytopenia, which can cause internal bleeding and hemorrhages, but that was nearly 9 times lower than the risk of the same condition following an infection. An extra 66 would be hospitalized or die from blood clots in the veins, but that was nearly 200 times lower than the risk following an infection. For every 10 million people vaccinated with the Pfizer vaccine, it found 143 extra strokes would be seen, but that was nearly 12 times lower than the risk following an infection.